So for people that have end-stage arthritis of the hip joint, for example, we always talk to everybody about what the options are as far as treatment. There is non-surgical treatments, which includes over-the-counter Tylenol, which can be a very effective pain reliever for arthritic pain. Sort of the progression, or sort of the next steps once these over-the-counter medicines aren't really providing you with adequate relief. We start to talk about maybe modifying activities, maybe incorporating some physical therapy to potentially identify some weaknesses that might be able to help you take some stress off of your joints and maybe provide you with some relief. The next sort of progression or the steps might be an injection. The downside to injections is that while they may work for a short period of time, they are not a cure for the condition, and what I usually tell people is that while they may work like this, then they're eventually going to work like this and like this as far as time. Now this is different for everyone, but some people do get fairly long-lasting relief after injection for arthritic hips. And if people decide that they've that they've exhausted the non-surgical options, then we talk about what the surgery options are. And when you've got end-stage arthritis of your hip, a hip replacement is a very reliable, very predictable, very successful operation for the management of arthritic hips. There's a couple of different ways that you can replace hips. There are various approaches to the hip. There's no free lunch. Every operation has pluses and minuses, and so then this is usually what we'll talk to people about and give them the options to discuss what kind of approach they might want to consider. So for example, if you are to approach the hip and take out the arthritis through the back of the hip, you have to move the sciatic nerve out of the way, and that's the nerve that gives you the sensation in your foot, helps you move your foot up and down, and you have to open up the capsule in the back of the hip. And you also have to take off some muscles to get down to that capsule to get to the back of the hip. And the downside to hip replacement with that approach is that is a hip that is more prone to instability, and you have to follow precautions to keep that hip in place. And so there's certain positions that you need to avoid should you opt for a posterior hip approach. Now, I'm not saying that that's a bad approach. It's actually an approach that we use weekly, depending on the individual circumstances, because you have to help people figure out what's the best thing for them, and everybody's individual needs are different. My preferred approach, when it is safe to do it and people opt for it, is an approach through the front of the hip. This is referred to as minimally invasive, muscle-sparing anterior total hip replacement. Now, like we had said before, there's no free lunch. And so to get through the front of the hip, you have to move the femoral nerve out of the way and the branches. And one of those branches provides you with some sensation on the front and the side of the leg. And nerves don't like it when you push them around. So there is an incidence of a funny sensation on the side of the leg after the operation. Almost everybody that has any of those complaints, that almost always gets better. But out of the thousands of operations, we do have one or two people who still might have a little bit of a funny sensation on the side of the leg after pushing that skin nerve around. But the benefits to anterior hip are there are no position restrictions. It is a more stable hip. And it's actually easier to take care of patients after anterior hip replacement. In fact, they do so well so quickly, oftentimes you have to slow them down because they are able to do so much so quickly. For example, physical therapy will be so excited about how quickly they're progressing, they want to continue to push people. And we've even had some patients who have even pushed themselves just a little bit too hard, and they'll start to experience some discomfort, in the immediate post-operative period, because they're just doing so well and they're so much better so quickly. So anterior hip replacement is fantastic, and it works great, and sometimes we even feel like it works a little too well. But and it's not that it's for everyone. There are certain circumstances where certain deformities or the certain needs of the patient may warrant a different approach. And so what I tell people is just discuss these options with your surgeon, and if you're deciding to have a hip replacement, you need to have the operation done by the person who does what they do best, and your surgeon will talk to you about what they do best and why they do it.